Welcome back, class. Now we are in the home stretch. We're almost done with the skeletal system. We are in the lower extremities. So get your master list out. Let's go through these bones. The femur, the big mighty femur, the biggest, strongest bone in your body. The femur. There is your femur articulating with the hip bone at what portion of the hip bone? The acetabulum. The acetabulum. So let's look at the landmarks of the femur. So let's go ahead and isolate the femur out. First thing you need to know is a right or left. Now with the femur, you always know this part is the medial aspect, and down here you're going to have, we call this the patellar surface. The patella is going to be sliding along the patellar surface here. So this is always going to be anterior. So here's your big femur. What is on your list? The head. So the head is this rounded, articulating ball right here. That is the head of the femur. The head of the femur is going to be articulating with the acetabulum of the hip bone. Then we have a fovea, this small little pit right here. Now the fovea, actually it has a ligament that is coming from it, and it's going into the acetabulum of the hip bone. This is to help anchor the femur into the acetabulum. So that's the little fovea. Pretty easy to see on a real bone too. And then we come to the neck. This is the neck. The neck. Head, neck. So let me This is the neck. Now the neck is important because it's the weakest part of the femur, and when you hear about, it's usually little old ladies with osteoporosis, they fall and break their hip. What they're actually breaking is the neck of the femur. The neck of the femur. So that's the neck. And then we have the greater and lesser trochanters. Now trochanter's are huge. They're going to be attachment sites for some pretty powerful muscles of your lower limb. So the greater trochanter is this guy. The lesser trochanter is this guy. So on the front part you can see the greater trochanter and the lesser trochanters down here. Greater and lesser trochanters, those are huge, huge, huge. Now the linea aspera. Now the linea aspera is going to be a line. It's on the posterior surface of the femur. The linea aspera, it's a line. On a real bone, it is real easy to see. So pick up a real bone and you'll see that linea, the line aspera. The medial and lateral condyles. So we need to get down. Let's go back to our anterior. Whoops. I just pushed that. There's the anterior. Here we have the patellar surface. Now we know this is medial, this is lateral. So if we just turn this here, medial, lateral, here is going to be our medial condyle. This is the medial condyle. How do you know? Always just look up at the head of the femur. This is always medial. Medial condyle. Lateral condyle. Intercondylar, in between the condyles, intercondyle, condylar fossa. Fossa is right here. It's in between the condyles. Some books may call it an intercondylar notch, but it's in between the condyles. The medial and lateral epicondyles, remember they are always above the condyles, so this is going to be the medial epicondyle, medial epicondyle. Lateral epicondyle is going to be around here. They stick out a little bit. Medial, and let's see if we can see them. So around here, this is going to be, oh my goodness, lateral epicondyle. Here you can kind of see it, medial epicondyle. The patellar surface, we've already done that. This is the patellar surface. This is always anterior. Is that it for the femur? Yes, yay. So you're done with the femur. Not too bad. Head, fovea, neck, greater and lesser trochanters, greater and lesser trochanters, the linea aspera on the back side, the medial condyle, condyle is your articulating knob, lateral condyle, intercondylar fossa or notch, and the patellar surface, the medial epicondyle, epi above the condyle, and lateral epicondyle. So that's it for the femur. So now let's go back to the next bone. So we have two lower leg bones. Two lower leg bones, the tibia and the fibula. What do you need to know about these guys? Well, number one, it is the tibia. The tibia is the weight-bearing bone. It is carrying the weight from the femur. It is being transferred down to the tibia. The fibula, which is the smaller lateral bone, is non-weight-bearing. It does not, you don't get any transfer of the weight to the fibula at all. The fibula is just there so muscles can have a place to attach to, but it does not transfer any of the weight from the femur to it. So the tibia, T-I-B, tibia, T-I-B, that is your thick inner bone, T-I-B, thick inner bone. It is the medial bone. Fibula, I call it the fibula, fibula, L-A, it is your lateral bone. But let's start with the tibia. Whoop. So what do you need to know about the tibia? Well, you need to know right or left, that's for sure. So when you pick it up, always get the anterior part first. Which is anterior and which posterior? The anterior part is real easy to see. You're going to have a big bump right here. That is called the tibial tuberosity. Do not have that on the back side. Tibial tuberosity, a big bump right here. And on the distal end of the tibia, you're going to have this thing that's sticking out. It's called the medial malleolus. Let's go ahead and isolate this bone out so you can see it better. So the medial malleolus is always going to be the most medial part of your tibia. Medial malleolus. So what do you need to know on the tibia? The anterior border or the shin, it's another way to know it's in the front, is this part right here. You can feel it on yourself. This is the anterior border, the shin. When you feel it, you can feel that sharp edge of that bone. See if we can make it a little bit closer. I don't know if you can appreciate it, but it's a sharp border here. There are no muscles over the anterior border. When you have shin splints, you're having some pain over this area. No muscles over this area. You've got connective tissue over this area. So anterior border, the medial and lateral condyles, So let's go ahead and go back here for a second. So you had the femur up here, right? So you had the big femur. This was going to be what? The lateral condyle of the femur. Let me get rid of the patella. Just hide it. So this is going to be the medial condyle of the femur, the lateral condyle of the femur. So it is articulating with the medial condyle of the tibia and the medial condyle of the tibia and the lateral condyle of the tibia. Medial condyle of the femur, yes. Here's the lateral condyle of the femur, medial condyle of the tibia, lateral condyle of the tibia. So let's go ahead and isolate out our tibia again. So this is the medial. Remember, got your medial malleolus down here. It's always going to be the medial aspect. Medial malleolus, medial condyle, lateral condyle, medial condyle, lateral condyle, and in between the condyles you have the intercondylar, in between the condyles, eminence. Let's see if we can see it. Intercondylar eminence. It's this projection, it's kind of sticking up, intercondylar eminence right here. We've already did, what else do we need to do? Tibia, make sure I got everything. Yeah. So the last one was the up close. Here's your tibial tuberosity up front. Oh my gosh. Come on, get smaller. And down. Oh my goodness. And down here we have the medial malleolus. So down here, the medial malleolus. So this is the big bump. When you go down to your ankle, if you go on the medial side of your ankle and you feel that big bump down here sticking out, this is what you're feeling, the medial malleolus. Now, with the fibula, let's go back to the fibula. On the lateral side, when you feel a big bump on your lateral ankle, you are feeling, this is the lateral malleolus of the fibula. The lateral malleolus is like I think they said it stands for a hammer, like a mallet. Not sure why they call it a hammer, but lateral malleolus is this projection down here. Medial malleolus down here. Those are the bumps of the ankle on each side, the medial and the lateral side. If you twist your ankle or break your ankle, if you roll out, you can break the lateral malleolus of the fibula. If you roll inward, you can break the medial malleolus of the tibia. I'm not going to ask you your right or left. Fibula, it's kind of hard to see. Just know the fibula is a lateral bone. It has the lateral malleolus, and it's a non-weight bearing bone. So that's it for the tibia. So now let's get down into the feet, the bones of the feet. So let's just go ahead and get rid of these guys. So we can just see a foot here. So you have, in the wrist we had our carpal bones, the wrist bones. Here we're going to have our tarsals. We have 7 tarsals. So we're going to start with, I did not want to get rid of you. Come back. Don't want to hide you. So this first bone, if I can get this up, this first top bone, there it does again. Okay, I'm not going to be able to do that. Let me figure this out and I'll be right back. We're back. Figured it out. Okay, this first bone, this top bone, is the talus. Talus. Now the talus is going to be articulating with the tibia. It's going to be, I showed you this in class, it's kind of rocking back and forth over the talus, this tibia. So the talus is this top bone. Move, move. So talus is this top bone. There's the articular surface of it. It's covered with articular hyaline cartilage, and there's the bony part of it, talus. Then this bone is the calcaneus. Remember the calcaneal region? That is the heel. This is going to be the heel of your foot. So this is the calcaneus. Then you're going to come to the top part, the dorsum of the foot. You're going to come to the navicular bone. It's right in front of the talus. Navicular, talus, navicular. Remember, this is your big toe. Always get you orientated. This is your big toe, medial. This is the medial part of your foot. This is the lateral part of your foot. So talus, calcaneus, navicular, right in front of talus. It's a medial bone. Then we're going to get to the medial cuneiform. The medial cuneiform, intermediate cuneiform, and lateral cuneiform. So medial, intermediate, and lateral cuneiform. Just write that word down, cuneiform. It's actually cuneiform. That's how you pronounce it. I always say cuneiform so I can spell it correctly, but it's cuneiform. You need to write those down for a lab practical, so practice that word. You're going to see it medial, intermediate, and lateral cuneiform. And then we come to the 7th and last bone, the cuboid. It looks kind of like a cube. So how do you remember these 7 bones? Tiger cubs need milk. M-I-L. M-I-L-C. Tiger stands for talus. Tiger cubs, calcaneus, need, navicular, milk, M-I-L-C. M, medial cuneiform, MI, intermediate cuneiform, MIL, lateral cuneiform, C, cuboid. So yet we are not spelling milk correctly. We are spelling it M-I-L-C. So tiger cubs need milk. Those are your 7 tarsal bones. Now the rest of the foot is basically like the hand. We had metacarpals in our hand. Here we have metatarsals. The big toe is metatarsal number 1, metatarsal number 2, metatarsal number 3, metatarsal number 4, metatarsal number 5. Metatarsal number 5 is your little not your little pinky, your little toe. And then we come to our phalanges. Same thing like the hand. Proximal phalange 1, proximal phalange 2, proximal phalange 3, proximal phalange 4, proximal phalange 5. Just like the hand, all our digits have a proximal, middle, and distal. Proximal, middle, woo, and distal, except for the big toe only has a proximal phalange and a distal phalange. Same thing, you would say proximal phalange number 1, distal phalange number 1. What bone is this? Distal phalange number 1, 2, 3, 4. Distal phalange number 4. Proximal phalange number 3. Middle phalange number 2. So not too bad. So those are the bones of the lower extremity. So we are done with our bones. Yay! So practice, just do one bone or one section at a time. Do not move on until you got those down. Study with real bones when you can. It always helps to have a 3D bone. And we'll see you in class for the big lab practical. Bye!